So, thank you, Chair, Honorable Ministers, ladies and gentlemen of the press. Thank you again for coming for another press briefing. Like I've said severally, we're in the process of scaling up testing across the country. And the key component that has changed in this is at least in Lagos, Abuja, and Kano, instead of waiting for people necessarily to call us, we are now going to where the patients are. So we've set up specific testing locations, of course in collaboration and under the leadership of the states in these 3 states to increase the throughput of samples being collected from cases that actually do meet the case definition. So we're now just not waiting for patients to come, we're going into the communities, into the health centers to identify people that meet this case definition and bring them in. We're doing this because we are now fairly certain that we do have ongoing community transmission, especially in these 3 cities, and we have to adapt our response to this situation, and we're doing this all the time. Our response strategy is an adaptive one. We adapt it to the circumstances in every state, every city where the nature of transmission changes. These changes means that more and more people will be going into the community. What does this mean? For us to go into your community, you have to accept us in. You have to be willing to accept the healthcare workers and support them and not stigmatize them. So all our healthcare workers are now trained to go in quietly, not to attract a lot of attention, but we really need Nigerians to support the work that they do and not stigmatize them or not stigmatize the communities in which they do their work. We're living currently, and this is a global phenomenon, we're living literally with COVID-19, but not the way we thought about it during the HIV era. So when we say we're living with HIV, we're talking about individuals, and of course communities as well. But this really is about communities. How can we as a country manage this as we transit into the next weeks? As we release the guidelines of implementing the non-pharmaceutical interventions that will be released very soon and was announced yesterday. We're doing this in the context of rising cases. And how do we manage these 2 phenomena? We have to manage it by recognizing that yes, we still have cases, but yes, we have to start up some level of activities. In order to balance these 2, we have to find a way of living with this disease and living with it in a way that we can control it, manage it, and continue aggressively responding to it. This will need the collaboration of all of us. Finally, a few words about Kano. Our response is improving. We now have 2 labs functioning. We have a 3rd one set up, and hopefully will go live by the weekend. The entire operation from identifying suspect cases, collecting samples, getting them into care, and ensuring that the whole process is working is improving. Improvements in public health are sometimes not obvious to see, but we're managing this very carefully, speaking to the colleagues, and together with the joint NCDC WHO teams that are combined in supporting the Kano State team, I'm happy to report that things are improving and will continue to improve. And I really thank everyone that has come to the table to support us with staff, colleagues, vehicles, logistics, coming together as one team under one leadership to support the efforts in Kano. These efforts in Kano are led by the Kano State government. We are there to support, and this support will continue as long as it's necessary. So we're in a marathon, not a sprint, like I always say. Improvements are gradual and not obviously visible from time to time, but I have every confidence that the work that we're doing in Kano will yield results, and we'll very soon see improvements in Kano like we've seen across the country. So I really want to encourage all our colleagues working at the state level, not only in Kano, but in 32 states across the country right now, to persevere in their efforts, to keep pushing. Together we'll get ahead of this. Thank you very much.
Thank you very much. We shall now take the questions